If possible, subjects should be blind to which treatment they receive. This eliminates any bias which might be introduced into the experiment due to the subject's knowledge and/or investigation. Placebos are often used to help blind subjects and researchers, as we will mention shortly. Subjects are given a treatment which is as similar to the actual treatment under study, and yet does not have the same effect. For drugs which are taken orally, this involves creating a pill which has no active ingredients, which looks the same as the actual treatment. Sometimes creating a placebo can be difficult, since it is obvious to the patient which intervention is being applied. The placebo effect occurs when patients improve because they think they are receiving treatment, even though they are not. In order to prevent the experimenter's ideas from influencing the results, the researchers are also often blinded to the treatment applied. Often researchers cannot know which treatment is applied to which patient until after the study is completely finished and the data are about to be analyzed. Possibly they may not be unblinded until after the analysis is complete to avoid any possible bias by the researcher. The most reliable way to determine whether the explanatory variable is actually causing changes in the response variable is to carry out a randomized controlled double-blind experiment. Some problems with experiments relate to human behavior. The Hawthorne effect results when people in an experiment behave differently from how they would normally behave. Lack of realism, also called lack of ecological validity, results when the fact that researchers take control of the explanatory variable results in a rather unrealistic setting. Non-compliance is an issue in experiments due to the fact that some subjects will fail to submit to the assigned treatment or fail to follow their treatment precisely. Although randomized controlled double-blind experiments are the gold standard, it often may not be possible to study a particular topic in this way due to ethical considerations. And even if you can carry out the experiment, the issues discussed here may still impact the usefulness of the study's results. There are strengths and limitations associated with both observational studies and designed experiments. Remember that the main difference is that in observational studies, the explanatory variable's values are allowed to occur naturally, whereas in experiments, the explanatory variable's values are controlled by the researcher. The treatment is imposed.